Now, we have a lot of people that sent us emails asking us about how they can tell that their child has a hearing problem or is actually deaf. I mean, a lot of people, they compare it to the story of Helen Keller, and they compare it to a lot of those stories. But how do you actually know that your child has a problem when he cannot tell you because he's an infant or he's just a newborn?
Basically, I like to emphasize the early detection of hearing. Yes. That's in the first day after birth. And we are looking to have a national program, and we are working in it. Thanks God we had the support of the Ministry of Health, as well as the Saudi Society for Deaf, Saudi High. They support by giving the equipments not very much expensive, but need to be trained on it, and it need to be widely spread all over hospitals, centers, even in the villages and the remote area. And that's a simple test to check the babies once they're born. And if there is any question, then they could go refer to a more sophisticated secondary or tertiary care center. And this you have early detection. But also you could, we like parents to watch their children. It could be just a simple reason, because of the recurrent infection in the ear. So they check their pediatrician, their ENT in their area, and those people could treat these simple things which help restore the function of the middle ear, not to go in the future to a problem which cannot be fixed except by surgery or hearing aid. So this is part of early detection to check if there is any fluid in the ear. Then you go to the most important problem, if there is a sensorineural hearing. What I meant by that, as I show in the video clips, that the hair cells is not much existing or absolutely absent because born like that.
Yeah, so it could be a hereditary reason.
Hereditary. So if this is the case, then they have to move, unfortunately, to a very sophisticated place where they could give them a good digital hearing aid, strong, powerful hearing aid, plus the education and training for language, and special education for deaf, because both party with the physician and the audiologist, they could help the family to guide the child, and if come to a stage the hearing aid is not working, then we go for cochlear implant. Parents had to check their children when they call them, when there is a noise around them and they are not moving their head, or they don't throw any attention to them.
They don't react to sound.
Yeah, but not vibration. That's what we want, because they come to the clinic and said, no, we watch him when we close the door, slam the door, they shake and move. That's because of vibration. That's no good. That's not a hearing.
Yeah.
So we want them to make sure that it is a free sound, and if there is any doubt, please go ahead and check. Don't let your child lose his opportunity of developing language and normal communication way of life.
I think